Dr. Aubrey Federal, and I'm at Valley MRI and Lodi MRI in Stockton and Lodi, California. We're going to be talking today about CT scanning, or CAT scanning, which is short for computerized tomography. And computerized tomography results from a marriage of super fast computers with X-ray tubes capable of handling a lot of heat that can acquire super thin images utilizing a razor thin beam of X-ray energy, which is picked up and measured by super sensitive electronic detectors after passing through your body. All this data is acquired non-invasively in a very safe and comfortable environment in the CT scanner. The scanners now, in fact, are so fast that the typical CT scan, once you're lined up, takes less than 15 seconds. Once this data is acquired, it's transferred to a 3D workstation. And what happens then, since the data is acquired in a way that allows it to be viewed in multiple planes and in varying degrees of thickness, the doctor can then look through your body from the front, the top, the back, the bottom, any direction they want, which allows you to visualize disease processes much more easily. So all these manipulations are done on this little workstation here. There's a computer down there that you can't see. And what's happened is that these systems are so sensitive you can frequently pick up significant disease processes that require intervention or treatment even before you have symptoms. There are multiple areas where CT scanning is critical for diagnosis, which we've broken down into a number of categories that I'm going to discuss separately. We'll look at them and then some of the images we can create. These categories will include your head and brain, the blood vessels in your head and brain, your abdomen and pelvis, your chest, looking for things like pulmonary emboli. We'll do angiography of the body, which is looking at the blood vessels after stripping out all of the soft tissue around them. We'll look at your peripheral vasculature for people with vascular problems. We look at your spine for any type of spinal problem you might have, and your peripheral joints. After you've had surgery, if you have hardware in, we can basically electronically remove that hardware from your body and look at the hardware separately for any hardware problems. So we're going to go section by section through this, so we'll get started now.